So the broadcast has started now.
Thank you, Emma. Good afternoon, everyone, and welcome to this Executive Decision Day. I'm Councillor Liz Fairhurst, and I look after older adults and public health, and this is Councillor Warwick,
who is the Executive Member for Younger Adults, Health and Wellbeing.
Thank you. So welcome, everyone. Emma, do you have any deputations?
We have no deputations today.
Thank you. Before we go on to the agenda, I'd just like to make a quick statement. None of us come into this role to make savings we are putting forward today. The proposals being considered will set out a range of options for how the County Council can close the £132 million budget gap we faced by April 2025 to continue to deliver vital local services to Hampshire's 1.4 million residents. Our costs have risen dramatically because of factors outside of our control: inflation, underfunding, rising demand for core public services like social care for vulnerable adults and children. As a result, our budgets are close to breaking point, and there simply isn't money to go around. This is a national problem playing out across the country. Now, we've always been very proud to maintain strong public finances for the people of Hampshire, and this has seen us through over a decade of national austerity. But having already reduced our spending by more than 600 million during this period, and now facing a £132 million budget shortfall by 2025-26, we have now reached a tipping point with no further financial safety net to fall back on. The results of our public consultation reaffirm it's right we continue to focus the money on those that we need to help the most vulnerable people in Hampshire. Residents have also told us that they agree that it's central government that needs to step in to help us balance our budget in future. Hampshire is in a better financial position than most other councils. I could quote Birmingham and Southampton. And while our finances are stable until 25-26, we do need central government to fundamentally change the way that local government services are funded, or reduce what councils are legally required to deliver. In the meantime, though, we can't just sit and wait for that to happen. We must plan on the basis that we'll have to close the budget gap ourselves, which is why we're reviewing these savings proposals now. It's clear that we must apply a combination of proposed tactics to help us balance the books. By law, we simply cannot spend more than we have coming in. I do appreciate that some of the proposals being put forward will change the way service is delivered, but will ensure we can continue to deliver that service for Hampshire. So, thank you for that, for listening to that. And I'll hand over to Mr. Allen. You're going to present this, or is it Mr. Archer?
Thank you, Councillor Fairhurst. If I could say a few words by way of introduction and then hand over to my colleague, Paul Archer, really to pick up, I think, probably some headline issues that would have been discussed, again, at great detail at this morning's Health and Adult Social Care Select Committee. So the report that you've got before you, and I apologise for the length of it, it's the best part of 300 pages, but it does go into a huge amount of detail. I think probably at this point I would say that the key headlines from my perspective, building on what you've already said, the report does outline in detail the contextual environment in which we've been operating as a local authority now for some 12 or 13 years. The approaches that we've taken across our adult social care services. It is important for me to say that whilst this is a report for adult health and care, the savings proposals contained within the report relate to our adult social care services rather than the entirety of adults health and care as a council directorate. There are no savings identified or required specifically of colleagues in our public health services that sit within the directorate. That doesn't mean that the way in which public health services continue to be delivered and developed don't continue to transform and improve, but because of course they do, but there are no specific savings requirements from the public health revenue budget. This really only results in a set of proposals for adult social care services. Subject to your decision today, this set of proposals would then go on to Cabinet in mid-October. Subject to Cabinet, it would then move on to full council in November. They are a set of proposals. They are absolutely a direction of travel, the majority of which build upon work that we've been doing over an extended period of time. But again, subject to decisions and the progress of these proposals, it may then result in some stage 2 consultation being required in the early new year. Following that, the outcome of those stage 2 consultation responses would be considered both by yourself, Councillor Fairhurst, and also by Councillor Warwick in May of next year. So I'll pause there. It is a detailed report. It does contain a huge amount of information, particularly within the equality impact assessments in terms of all areas. But I'll pause and hand over to Paul Archer to say a couple of more headlines, I guess, arising from this morning's HASC and key elements within the report. Paul, over to you.
Graham, thank you, and good afternoon, everyone. Excuse me. So just in relation to this morning's HASC, Anne and myself went through the full range of proposals. We talked about the background and described the County Council context, which yourself, Councillor Fairhurst, and Graham have just alluded to and covered off as well. We then went through at a headline level the proposal areas and then took some questions and answers from various members of the HASC committee before the recommendations were formally approved. So it was a positive engagement this morning. Lots of concern in the same way that you yourself, Councillor Fairhurst, expressed the challenges that we've got. None of us take any pleasure, as you say, in bringing those types of reports and presenting the sorts of issues. But I think everybody this morning is cognizant of, you know, the limited choices we've got and the absolute necessity to balance the budget. At the meeting this morning, I talked a little bit about the directorate context, which again has been touched on, but we've got this savings programme running alongside a very challenging business as usual environment, and this savings programme running on top of and in addition to still £7 million of savings we've got to deliver from the 2 previous programmes. And as I said to HASC members this morning, just by their very nature and by dint of the timing, those remaining savings are the hardest savings to deliver across those 2 programmes. So we've just got a multitude of things all adding up against us. And when one takes into account service demand, increasing age profiles across the age 65 and plus across the county year on year, the complexity of our demand across all adults 18 plus, higher numbers of children transitioning into adulthood with needs, NHS stuff, which we had this morning, difficulties that they're in facing, voluntary sector bits, the market bits. It's all an absolute recipe for just constant and relentless challenge and difficulty. We talked a little bit this morning about a net budget excluding public health of 470 million, and I made the point that our operational spend, whether it be younger adults, older adults, or what we spend on our provider arm HCC Care, adds up to more than 420 million. So that both goes to exemplify that we spend the bulk of our money on operational services, and also demonstrates that even if we wanted to eradicate expenditure everywhere else, which obviously we wouldn't be able to do, and it would be nonsensical in the sense of where the operational elements need support from across the directorate. We could not balance our books just by looking at the non-operational arenas. So as a consequence, and as Graham outlined, we will look to, through these proposals, to continue a journey that we've largely successfully trodden over the last 12 or 13 years, but a journey that's getting harder and harder around introducing more strengths-based approach, introducing more technology, seeking more outcomes from our collaboration with the voluntary sector and with the NHS and with partners, and the range of other things that we do day in, day out, the technology, the prevention stuff. It's just getting harder and harder. Our savings proposals can largely be broken down into three main areas: younger adults, which are the bulk of the proposals at 28.7 million, older adults, which are at about 14.1, and headquarters and the governance arena services at just around £5 million. Just because the numbers differ in the category boxes doesn't mean that the savings are any easier to deliver and doesn't mean that we haven't got immense challenges in each of the three areas. And Graham again referenced stage 2 consultations. It's actually in the £5 million worth of HQ savings that we would almost certainly be needing to do 3 stage 2 consultations. One around the way in which we support the voluntary sector through the infrastructure grant. One about us removing support and expenditure in the social inclusion arena. And the third area, which escapes me, I'm sorry, the all important one, obviously, around the 95% income that we take into account when we do assessments and work out social care contributions. We're proposing to move that to 100%. And as I outlined this morning, that 100% is very much in keeping with many other local authorities. We've been one of those outliers by only taking into account 95%. In those operational areas for younger adults and older adults, it very much is a continuation of successful projects and programs that we've done before, particularly around facilitating accommodation type services, around doing more extra care and more supported living, particularly for the younger adults arena. And we've still got capital provision in both of those areas to enable us to do much more in the coming years, which in turn will reduce our revenue exposure. It's about getting our frontline staff practicing strengths-based approach in a consistent and really effective manner. And it's about us working harder and more tirelessly, including with public health, around all things prevention, trying to get better use of things like Connect, Support Hampshire, trying to divert people, trying to support people, trying to find alternatives to paid for care for those that come to us for help and support. And again, obviously within that, and I mentioned it this morning, more technology wherever we can deploy it to give people more assurance and to make the families, loved ones feeling happier and more confident around the support that they've been given. Don't think I want to say much more. I said this morning that this comes with all sorts of risks, but the risks are well trodden, whether they're around workforce, whether they're around just the nature of the extent of all of the different projects and programs we've got to work through, whether it's about making sure that we continue to meet people's needs. We are well tried and well tested in these arenas. And even though, you know, sometimes there's subjectivity that comes into play, we absolutely stand for meeting people's needs where those needs are clear and that people need our help and support, and we will continue to do that wherever possible. And lastly, Graham mentioned the equality impact assessments, and that's the thing that's turning a usual 30-page report into a 300-page report. I made the point this morning that equality impact assessments are a living, working, breathing document. They travel with us from inception of the idea all the way through the decision making, the execution of the savings, and afterwards as well. So my comment to HASC members this morning was that we will continue to adapt them, continue to adjust them, continue to update them. So if there are any queries or concerns or any issues relating to those, we will just keep receiving those comments and feedback and acting on it in the professional manner that we can. Graham, I don't know if you need me to say anything more specific or if I've missed something obvious that you were hoping I was going to say, but I'll stop there at this juncture and give you a chance just to close off.
Yeah, thank you, Paul. No, there's nothing that I particularly wanted to add. I just wanted to further underline comments already made. So we come to these proposals reluctantly, but we must come to these proposals. We put them forward on the basis that these are things subject to agreement and in due course discussion, debate and approval by both Cabinet and County Council beyond any decision that you make today, Councillor Fairhurst. We come to them on the basis that we will take them forward positively, albeit reluctantly, but positively, and on the basis that they are deliverable and achievable, albeit within the very tough operating environment that Paul has already set out. So as DAS, I believe they are achievable. I think they are proposals that effect a degree of saving in what I would term probably the safest way that we can imagine. But of course, as we always do, we will tread very carefully as we go forward. We will work with partners, both internal and external, subject to decisions that you and Cabinet and Council make in due course. So thank you very much indeed.
Thank you. Can I just ask, I was at HASC this morning and I did hear what the members of HASC had to say, including the opposition. I'm really disappointed that we don't have lead members from the opposition parties here this afternoon. It's something that is so important in Hampshire. I just wondered, Mr. Allen, have you had a chance to speak to any of them?
So I've heard individually from Councillor Taylor from the Labour group. Councillor Taylor had a specific question and concern relating to the proposals around staffing capacity and our governance and assurance function within headquarters. I've responded to that on the basis that quality is something that's embedded across all our services, and of course we have a new CQC assurance process. We've been heavily involved nationally with the CQC in the development of that, but along with all other local authorities, we will be subject to an annual assurance programme by the CQC. I believe that we have that, as I say, as a quality and assurance framework embedded across all of our services. So I think that those proposals are well founded. We did meet with Councillors Harrison and Tree in the opposition briefing. They asked us a number of questions for clarification, all of which we answered. They gave no indication in terms of either support or opposition towards the proposals during the course of that opposition member briefing.
Thank you. Councillor Warwick.
I have nothing really to add other than to thank Paul and Anne, and I think you did an excellent briefing at the HASC this morning. I think for some members, perhaps it was the first time they were seeing these proposals, so I suspect we'll get more questions and inquiries as time goes on, as we approach the Cabinet and the Council decision making. But I know, Graham, you and your team have been very diligent, and I know you've been perhaps looking at these savings proposals year on year for several years now, as Paul mentioned. But actually, I think to see the use of technology and to try and be inventive in how we're sort of making those cuts, if you like, is really reassuring to us. So I just wanted to thank you and your team for all your work in bringing this paper forward. Thank you.
Councillor Withers.
Thank you, Executive Chairman. I reiterate what everybody has said. Basically, HASC had an excellent presentation. For those of the members that had read the full brief, for those that have been with the County Council, certainly for a number of years, this is my sort of 7th year, will have seen the measures that have been taken in the past and the progress in the professionalism in the way people have dealt with the changes and proposals that are needed to go forward. And also the organisational changes that have been made upfront by the County Council to ensure that we look at every aspect when we're talking about these proposals going forward to enhance and ensure that our professionalism and the service that we give meets the demands of the community as well as we can expect on the monies that we've got. So a big thank you to the professional staff and Paul and Anne this morning and all the support that they gave us in their presentation, and I fully support the proposals.
Thank you. Councillor Briggs, do you have anything to add?
Not really, Chairman. I thought it's so difficult for everyone. None of us want to do this. I did read the whole report and I sent in 3 questions to ask, but I didn't ask them in the end because when Paul did his questions and went through the report, there was so much clarity there when it was spoken than actually reading it that I didn't need to. And again, I'd like to commend you all for your hard work. It just can't be easy. And obviously we've all got concerns, especially mine, about younger adults who've been through lots of transformations before in their young lives and probably will go through a lot more. But I know you'll all do your best in our limited resources. So thank you, Chairman.
Thank you, Councillor Briggs. Right, if we could turn to the recommendation, I think we have no choice. We have to approve the submission of the proposed saving options contained in this report and Appendix 1 to Cabinet and take this forward. So thank you all for that. And now, if we move on, I think I'm going to ask Emma to talk about some appointments to outside bodies to the partnership boards. Emma.
Thank you, Councillor Fairhurst. Yeah, we've got a couple of vacancies that have arisen on some of the outside bodies to which we normally appoint. We've been made aware of some nominations, so we brought those today for your approval. Shyla Mackenzie is the nomination for the Hampshire Hospitals Governor for Young People role, and Councillor Penman for the Hampshire Learning Disability Partnership role. So we're just seeking your approval today to make those appointments formal.
Very happy to approve. Thank you, Emma.
Thank you.
And I actually think I'm now going to hand over to Councillor Warwick for her younger adults.
Yes, and thank you very much, Councillor Fairhurst. And our D-Day continues. I'm Councillor Joan Warwick, Executive Member for Younger Adults, Health and Wellbeing. And I have one paper on my decision day, which is the re-procurement of the Hampshire Advocacy Services. Very important proposal under the Mental Health and Care Acts. I think Cecilia and Jason, you're going to speak to this paper. Thank you.
Good afternoon. I'm Cecilia from Younger Adults Commissioning, and I'm here to present the report on the re-procurement of Hampshire Advocacy Services. Today, we are seeking permission to spend up to £5,867,250 over a 5-year contract to re-procure advocacy services across Hampshire. This value includes contributions from Children's Services, Hampshire, Isle of Wight ICB and Frimley ICB, totalling £787,250 over the 5-year contract. A new section 256 will be entered into with Hampshire and Isle of Wight and Frimley ICB aligned to the new contract. Act. The requirement is set out in several key pieces of legislation and guidance: the Care Act 2014, the Mental Capacity Act 2005 and Code of Practice, the Mental Health Act 1983 and Code of Practice, and the Health and Social Care Act 2012. Advocacy services support someone or act on behalf of an individual to represent their views, their interests and wishes within formal processes, assessments, hearings and interactions with other groups and organisations on a range of subjects that affect them and their lives. In summary, the current contract expires on the 31st of the 3rd, 2024, and a new advocacy service is therefore required to ensure continuity of statutory service provision from the 1st of April 2024. The proposal outlined in the paper represents a continuation of the effective partnership arrangements and commitment by Adults Hampshire County Council to the current existing level of investment in advocacy services. It is proposed that Adults Health and Care will procure the new advocacy service. We will act as a lead partner. We will receive financial contributions from named partners. We will hold the contract and administer it via contract monitoring arrangements, working closely with our contributing partners.
Super, thank you so much. Jason, is there anything you wish to add to this paper for clarity?
Just one thing, I suppose, just in terms of although Younger Adults Commissioning would be commissioning this contract, the service provision for advocacy does actually span older adults as well. So it's not just restricted to younger adults. It's across the entirety of adults health and care provision.
Yeah, that's really important. Thank you so much. Mr. Allen, is there anything you'd like to add at this stage?
Yeah, thank you very much indeed, Councillor Warwick. Just to really underline that this is a statutory responsibility that we have to make sure that these advocacy services are in place and they're fit. So I would commend the report and the recommendations to you. Thank you.
Yeah, thank you. Councillor Fairhurst, is there anything you wish to say?
I would just say, in the past, having been co-chair of the Partnership Learning Board, disabled people, how important this is, that their voices and not the voices of those around them are heard. It is vital that we hear what they want.
Yeah, brilliant, thank you. Councillor Withers and Councillor Briggs, is there anything you'd like to add to this paper?
No, I fully endorse it as co-chair of the Hampshire Learning Disabilities Partnership. I think it's an excellent contract and must be maintained.
Councillor Briggs.
Thank you. I also support it because it's very important that, especially for me, our young people and care leavers have someone to speak for them. Thank you.
Brilliant, thank you so much. So I'm very pleased then to make the recommendation under item 2 that I approve to spend up to £5,867,250 over 5 years for advocacy services across Hampshire. Thank you so much. That concludes our decision day. Thank you.
Thank you.
Thank you.
Thank you. Bill, can I just ask you, is tomorrow at Hampshire or are we online for Hampshire hospitals?